is Dr. Srinivas Deshmukh. I'm a consultant neurophysician at the Deccan Hospital, Somajiguda, Hyderabad. So today I'm here to talk to you about a few words on a very common neurological disease, that is epilepsy. So this disease is very common in both outpatient department, and we see so many patients coming to us with emergencies related to epilepsy which need IP or admission care. When it comes to epilepsy, there are a few myths about the epilepsy, that whether the question that arises in the mind of many patients is it curable or not. So the patient has doubts about how the disease will be, how his life will be. His family members, his or her family members are also worried about what is the outcomes and how is the prognosis. There are a few points to remember when it comes to epilepsy. Remember that this is a disease which can be well controlled with the help of medications, and about 20 to 30% of the patients can achieve complete cure from epilepsy when they are treated properly with the appropriate medication or with appropriate treatment like surgical options. Around about 60 to 70% of the patients respond very well to the anti-seizure drugs, and these drugs need to be continued for approximately 2 to 3 years, after which we can attempt to taper the medication and reduce and completely stop the medication if the patient has shown complete seizure freedom and if his EEG and other investigations are normal. In certain situations, the epilepsy medicines have to be taken lifetime. But even if you have to continue the drug for a long time, we select drugs which have less degree of side effects and which have higher degree of efficacy. That means they will be working well for the patients with minimum side effects or minimum drug-to-drug interactions. So that way, the proper drug is selected, proper diagnosis is made, and based on that, the treatment is advised. In about just around 10 to 20% of the patients, some surgical treatment options have to be thought about. For example, if there is a lesion in the brain, some tumor, or if there is some disease like mesial temporal sclerosis, where surgery is the preferred option. Otherwise, most of the patients, around 80% of the patients, can achieve complete seizure freedom with medicines only. And another important point to know is that this particular disease, can a person lead a normal life? 100% the patient can lead normal life. There is nothing to be worried about. There should not be any stigma regarding epilepsy. It's just like any other disease like diabetes or hypertension, where we are taking medicines and the disease is very well controlled. It doesn't spread from one person to another. So all these points need to be kept in mind. The person can completely go back to normal life. Absolutely, there won't be any problems in that. So what is important is to have a proper diagnosis, proper follow-up with the neurologist, and to follow the instructions given by the neurologist. Thank you so much for your patient listening.